When I was in Liverpool as a GP, we looked at different ways of managing patients with long-term conditions, as there was great driving force due to the realignment of our acute trust and year-on-year failure in that part. And so we developed proactive care. This involves a fundamental shift in the way care is delivered. So we were fantastic at doing episodic care. We commissioned single pathways fantastically. So we had COPD pathways, heart failure pathway, you name it. We had all those pathways, but we achieved very little with it because all the teams within those pathways only concentrated on that specific. We realized that most patients with long-term conditions have comorbidities, so we needed to change that. And one of the things is we needed to integrate the way we work, and we realized we needed to involve social services as well, because most of the drivers for admissions was due to social circumstances more than clinical circumstance. And we wanted to, instead of looking at our frequent flyers, hospital avoidance schemes and things like that, we wanted to work a little bit more upstream, identify people before they get to that stage, and basically to manage that so that we can delay that progression and minimize their illness. Our ultimate aim was to decrease in emergency admissions for those people and manage people with long-term conditions in the community. And we're trying to develop a process where patients with long-term conditions are no longer managed in hospitals, but in communities instead. And one of the ways we recognized that this had to be achieved was to involve the patient in the decision-making process. And we needed to emphasize personalized self-care. So when we go into the patient's homes, we look at their housing, we look at their home circumstances, because without looking at that, we wouldn't be able to define the context of their illness within their home within their surrounding. So we not only look at their medical concerns, but their social and psychological needs. And this is all carried out by a multi-agency team, because patients are fed up of telling different teams the same thing over and over again. So we wanted to do this once and do it well. Proactive Care is a 12-week program. We assess clinical, social, and psychological needs, and this is done by all members of the multi-agency team. With involvement of the patient, we devise a personalized care plan, and this is agreed with the patient and their relatives and carers as well. And we offer intensive support throughout this process for the patient and their carers. So what we learned from that was poor drug compliance, lack of disease understanding, pain was also an issue, and anxiety by relatives and the patient caused their admissions. So from the initial study we had, admissions fell by 88%, average length of stay reduced by 56%, and we had a cost saving around 77%. Importantly, we utilized a questionnaire called EQ5D. This is all patient self-reported questionnaire, and one of the questions was mobility, the ability to walk. And initially, this was poor, but after the 12-week program, there's been a threefold increase in the number of patients who are now reporting as that walking is not being a problem. Self-care, ability to wash or dress oneself. And again, we've shown that there's been a massive improvement in that as well. Usual activities, this is important for social services and employment and such. And we've shown that there's the percentage of patients who reported having no problems with their ability to do usual activities, this is more than doubled. So there's potential for these patients to go back into the working community. Pain and discomfort. Interestingly, there's a cohort of 10% of patients who, despite all this, still have pain as their main issue. Anxiety, depression, this is also increased. And lastly, this is, for me, is quite an important thing, because we rank their scores from 0 to 100 as to where they were at that time. And in the beginning, most patients were around 38, which would correlate to their severity of their illness. But after the 12-week program, they're ranking around 70. So that's getting back to normality. So that's getting them up to the the point where they could start to think about interacting with society and getting into jobs and going back to work.